Good morning, ladies and gentlemen. My name is Gbadebo Anifuoshe. I work as a project manager with the Great Minds Group Events Management, the organizer of today's event, and I will be today's boardroom facilitator. Thank you for joining us today at the Keeping People Safe and Operation Running Faster in the Middle East Healthcare Rendezvous, which is presented by Everbridge. This roundtable discussion is hosted to discuss a unified approach to critical event management for healthcare sector. We have with us today experts that will be sharing their thoughtful contribution on the topic, and I encourage everyone to take part in the discussion by sharing your questions and comments. Thank you once again for being here. And I did like to thank our speakers and the boardroom partner, Everbridge, for their participation and support and for making today's meeting possible. Before we start, I did like to mention a few housekeeping notes. As you might have noticed, keep everyone on mute. This is just to reduce the background noise. And I'll encourage every one of us to put our cameras on so that we can better interact with each other. And should by chance you have comments or you have questions, please use the raise hand button, which is below the participant list. You can find it over there. And should in case you drop out from the event, either due to the network issue, you can log in back to the event using the same link sent to you. To go over today's agenda briefly, we will be having 3 eye-opening presentations, after which we will dive into the panel discussion session. And today's roundtable will be rounding up with key takeaway, and immediately after the key takeaway, we're going to be having the closing remark. I would like to introduce all our esteemed speakers for today. Please welcome with me Elias Oshem, who is the Account Director of Middle East Everbridge. Thank you for joining us. And we also have with us today Natalie Senzabal, the Customer Success Director for Healthcare Everbridge. And with us today, we have Eric Shewind, who is Industry Solution Manager with Everbridge. Thank you for joining us. Without any further ado, I did like to hand over. I would also like to take a very quick poll session so that we want to know your feedback about the question that will be displayed on the screen now. This will take only 30 seconds. I will appreciate if you can just click. Yes, I can see the feedback is me running. We have, okay. I'll give like 10 seconds more. Okay, fine. Elias, what do you think about the poll?
Oh, thank you very much. So, welcome, ladies and gentlemen, to our session from Everbridge on critical event management. Yeah, so the poll, I believe, as expected by, attributing an educated guess, it's numbers I was kind of projecting, 20% yes, roughly, and 80% no. It comes in at 14 and 86, so I was not too far off. There is probably an answer to that, because on the vertical of healthcare in the Middle East, we have not been doing a lot of activities around that in the past year. The Everbridge platform and Everbridge services are relatively new to the region, and we have started investing on this perspective quite recently in the last 2-3 years. So yeah, indeed, that's the way I would interpret those numbers. Typically, we would be on a 50-50 from what we've seen on other industry sectors like oil and gas and finance. Probably out of the US, if a similar poll is run, it would be a little bit higher. And I would leave, of course, some comments on that to my colleagues from the US. But we can definitely move on at this point.
Thank you so much for that, Elias. Without any further ado, I would like to hand over the floor back to Elias, who is going to carry us through his presentation. Over to you, Elias.
Thank you very much again. So my name is Elias Shaime. I am an account director managing the SaaS business for the Middle East in Everbridge. As stated previously, Everbridge is a mission-driven company. So in a very simple statement, what we do is we keep people safe and businesses running faster. Now, this is again a very broad statement, which we will try to dive into some more details as we go through our presentation deck. We are a publicly owned company quoted on the stock exchange. We have 6,000 plus enterprise customers. We are present on multiple verticals, as you will see and appreciate. The use cases which we are capable of leveraging through the platform are quite broad, which allows us to reach these different verticals across the globe. Again, as I stated previously, healthcare is a relatively new approach to us in the Middle East. So there are some nuances which we will need to address around that as we move on and as we learn how this market is working currently. We're present on 200 plus territories, including 12 countries. So again, here there's a slight nuance in the two terminologies. When we say a country, it means that we are providing alerting and warning services to the entire country or to the entire government of that country. So some examples can be as customers who lately joined the Everbridge platform. We have the Netherlands, we have Australia, we have the UK, Greece, I believe, Peru. Again, the list goes on. I would invite you to have a look at our website if you're interested in looking closer at our customer registered on our platform. From a territory perspective, what we indicate here is more the corporate side of things. So it's private companies who register up on our platform. And when we say 200 plus territories, what this really means is that we're present on 200 plus countries where we serve corporations in these different countries. We are quite known for our innovation. Actually, Everbridge is the first company to have coined the term CEM, which is critical event management. If you look at a little bit literature around this topic, we go back 10, 12 years back when we started introducing this concept primarily. Only recently you can start seeing with Gartner reports and certain specific literature around that this term has started to pick up with other competitors and with other actors who are starting to, let's say, participate in this market. We are known for being customer driven. We own 160 plus worldwide patents around our platform. And most importantly, we can provide 350 plus ecosystem integrations, which I will touch upon later, because as we go into more details, we will see that the platform is composed of different services that can be leveraged, but these services are only as good as the information that can be provided to them, right? So, and if you can integrate the platform with other technologies that you already have available in your organization, that's where you can get the most out of the value from the platform. It is primarily a SaaS platform, but we do provide the services in a hybrid model as well. So some key numbers in there, we provide by SLA an uptime of 99.99%. We have a little bit over 2 billion people were reached in the past, and the messages or net notifications sent out in the last year or so are a little bit over 5 billion messages. Very good. So introducing the CEM platform, as I stated previously, we tend to see ourselves not as a technology vendor, but rather as a vendor who provides services around critical event management, which happens to provide the technology around that as well. And we do that by following this paradigm of assess, locate, act, and analyze. And we provide this layer of automation and orchestration around that. And everything we do, everything we provide in terms of services gravitates around this fundamental concept. And we will see that we have that capability of segmenting the functionality, segmenting the services as they go to each one of these blocks. So on the assess part, what we primarily do here is provide customers with an understanding of their context, their risk posture, and providing ways for them to utilize all of that information in a digitized manner. And basically what that provides is an understanding of what are the bad things going or happening around you as a user of these services. Now, not all the bad things that happen around you, you need to care about, right? So you would only be caring about those bad things which will impact or intersect the location of the things that you care about, which are what we typically call assets. So again, the platform provides this correlation, this capability of correlating these two information. And once we have a positive match, we have an intersection of something bad happening with something that we care about, that's when we can raise what we call a critical event. And once we do that, we need to act upon that critical event, right? So this is where our communication engine kicks in. So we provide multimodal communication in bidirectional fashion across different channels. Just to provide you with some quick examples, if we can provide up to 100 different modalities across different devices. The distinction here is if you take the device, which is your mobile phone alone can carry up to 5 different modalities of communication. So it can be a voice call, it can be an SMS, it can be an email message, it can be a push notification on your mobile app. It can also be a chat facility, quite similar to what you have today with WhatsApp, but with some additional advantages that come along with that. In the ACT component, we also have a fully fledged crisis management platform, which allows you to do, again, crisis management as per ad hoc literature around that. So we give primarily the ability to store SOPs, to provide tasks, to do all the reportings around that, et cetera, et cetera. And last but not least, the analysis component of the platform allows you to generate all sorts of reports around everything that has been digitally captured in the primary three components. And then we kind of cycle around that, allowing you to enhance any procedures that you have in place to do all the reportings and provide, stakeholders with the different visibility on what's going on in their organization. Now, how do we obtain all of this result? Well, we obtain it by integrating with the lower layers, which are the different technologies. This is when I referenced the integration points in the previous slide. And the ultimate result is what you see on the top layer, is that single pane of glass, which allows you basically to funnel all of that information in an organized fashion. It can be as small as your mobile device. It can be an iPad, or if you're looking for much more real estate to be able to manage more information on that, it can be different multiple screen panels that you hook up as you would see in emergency operating centers, in which then you would then appropriately configure them to consume the right information when needed. All of this, again, as I said, from a single pane of glass, allowing you to have virtual teams which coordinate all of the different activities and have visibility along that. So this is, again, in a nutshell, what we do, and hopefully my colleagues will try to address and showcase in more detail how we go around that in the healthcare ecosystem, right? So in the healthcare ecosystem, everything gravitates around the patient. So all these services and microservices that can be combined to provide an added value of service around these. We will see with some concrete examples how these are done. These are some very few examples of use cases that we can leverage as they go from safety and business continuity to employee engagement, security operations, digital and IT incident management, you name it. Again, it's very broad. It would take us a little bit more time to go through all of these. The next slide also addresses this from, let's say, public safety use cases. If you recall in my opening statement, I provided some information declaring that Everbridge has 2 fundamental branches. One, it's more geared towards the public, so governments and countries, and one towards corporations. So here again, we have the technology which scales and allows you to leverage all of this information around that. Again, for the sake of time, I will proceed on rapidly. I think it's important to highlight, and we probably don't do that enough, and stress the state-of-the-art security and compliance to which we adhere to. So we adhere to the most stringent certifications around security and privacy across the globe. Some of them are specific to certain regions, to certain countries. Others have been adopted as a broad standard, as, for example, GDPR. And again, we can go through all of these details, the need be. The logic here is to state that the platform is secured. we can provide all of those certifications and information around the notions of how secure the platform is and how secured your investments are with us. What's our commitment in the Middle East? So again, as stated in my opening statement, we are relatively new in the region in the sense that from an Everbridge perspective, we've been on this market for 2-3 years, but through some acquisitions that we have done as well, a company called CNL, which is more present in the PSAM sector. We've been present in the Middle East for over 10 years. And again, if you have some more questions around these aspects, we can definitely look into them. We do touch upon that on the healthcare perspective quite briefly. And again, my colleague will look into those throughout his own presentation. So this is why we are comfortable saying we have over 10 years of experience in the region. And we will see that from the list of customers that we entertain as well. We have offices in Abu Dhabi. There are plans in doing so in other countries. We have a customer support, which is localized, software development, delivery, product training. Again, everything can be tailored towards the specifics of the region. Last but not least, the platform is internationalized. And of course, Arabic is completely supported, including our mobile app, because many of our competitors claim that their software supports internationalization in Arabic, but then when it comes to more delicate aspects like using that software on mobile applications, where all the challenges of using different languages and writing from right to left are all bubbled up, we can demonstrate and highlight how we're capable of doing so on the ground. Of course, our mission is as well your success. We can leverage our professional services organization and implementation. As I stated previously, we tend to see ourselves as a services organization, not only as a technology provider. We can provide our support and live support with different tailored services, including 24/7, 365. We have dedicated account managers. Of course, it will depend on your use cases, on the size of your organization, but we can also leverage that. And last but not least, we also have infrastructure available to our customers, which they can leverage so that they learn as they go, and they can use these online training tools for them to enhance their knowledge around how we do critical event management with our platforms. I won't go into the details. As I stated before, we are comfortable in claiming that we are present in the Middle Eastern region with certain technologies for more than 10 years. These are some of our customers today. We would love to see some more healthcare customers as well. And this is the logic which has pushed us as Portal to do something which is more tailored and geared towards the healthcare system in the region. From a global perspective, of course, these are some names, and hopefully my colleagues out of the US will be capable of speaking a little bit around those. My knowledge on what they do and their use cases is a little bit limited due to the fact that my region is the Middle East, but definitely we can share some insight with you around what certain customers are doing with us and how they rely on Everbridge technology to keep their people safe and their businesses running faster. And with that, I would come to the next poll, which I would invite you to participate in, just to have a feeling a little bit on how your organization's maturity has developed throughout the years. Again, we're expecting some results which are a little bit different in the healthcare vertical. We have a clear idea of how that works in other spaces. So have you organized your crisis management plans in how do you organize them in your organizations? Thank you. We'll give that 30 seconds, 60 seconds.
Please, we encourage everyone to participate in this poll session.
Very good. So we're kind of stabilizing around the 50-50. It's 45-55 roughly.
So
yeah, I think we're good. So we have a 47% state no, 47% state partially, and 5% state yes, which means that they have fully digitized their plans, which again is quite harmonized with what we've seen. in the region with other actors. But again, we would probably need to delve into more details on what is intended by crisis management and crisis management planning for us to be able to fully interpret this data. But it's interesting at least to have a superficial idea of what that represents. Very good. At this point, I would love to hand it over to my partner in crime and my esteemed colleague, Mr. Eric Chetwin.
Thanks, Elias. Appreciate that. If you click through to the next slide, please. So just quick background on myself. So I'm super excited to be with all of you today. I run our go-to-market strategies for healthcare at Everbridge globally. And so bring sort of a health IT perspective and worked with many of the customers that Elias has highlighted in the previous slide. And I'm excited to share some of the things we do in healthcare at Everbridge with customers today. Could you click to the next slide, please, Elias? So when we talk about healthcare at Everbridge, we really think of it as healthcare provider organizations. And there are really 4 core areas that we work with customers on. The first and fundamental one is what we call environment of care, or which is typically things like managing natural disasters and issues that happen that would impact your health system, earthquakes, landslides, floods, tropical storms, those kinds of things that are natural disaster related, as well as many man-made issues, right? Everything from biohazard and chemical spills, pandemics, which of course, unfortunately, many of us have experienced over the last year and a half plus, fires, utilities, et cetera. The second area that we work with health systems on is in the safety and security area. We'll go into detail on each of these as we go through the slides here, but that includes things like protecting our staff, right? Nursing staff, clinical staff, from everything ranging from workplace violence to other types of incidents that may impact your health system, as well as very common use cases I'm sure many in the audience are familiar with, things around infant abduction and patient elopement issues that may occur within a health system. The third area that we do work in is IT systems, right? So I think we've probably all experienced the transition over the last 10 plus years or so to electronic health records, many electronic systems. IT is critical in healthcare. And unfortunately, again, during the pandemic, during the past year and a half plus so, the rise and attack on health IT systems has significantly increased. So we do a lot of work around protecting against ransomware, cyber attacks, planned and unplanned downtime, and et cetera, in the IT area to get those systems back up and running so you can provide patient care. And then really the last area, and certainly probably the most critical to the health system, is clinical operations. So we do a number of things and work with clients across the globe in everything in supporting clinical teams and their communications and collaboration daily, and all the way even extending out to patient experience. And this is some of what we do, as Elias highlighted. We work with, although we haven't done a lot of healthcare, obviously, with our Middle Eastern clients, we do work with over 1,300 health systems across the globe, providing these types of service. Many of the large, if you saw the slide earlier, for those in healthcare, you probably recognize some of the names, Cleveland Clinic, Mayo Clinic, a lot of the large health systems that we work with, providing these types of services. If you could click to the next slide, please, Elias. And, what we do in each of these areas foundationally is what Elias was calling critical event management. And again, fundamentally, critical event management from an Everbridge perspective is when something bad happens that impacts you, the things that you care about, whether it's your patients or staff directly, or your operations at your health system, which would impact the care you can provide. And so in each of those areas that I just shared around environment of care, safety, security, IT, and clinical operations, we provide the capability to follow this cycle of assessing, understanding something that might impact the flow within those teams, locating people who can respond or collaborate, and you'll see some examples of this, and then act upon that, collaborate in real time, very fundamental, as well as making everyone aware of the situation that may be occurring. And then, of course, as with all systems that you would expect, right, the ability to analyze your effectiveness post-event, post-activity, so that you can improve it the next time. Next slide, please. We can probably click this out. So when we talk about responding to critical events, Ilya's kind of talked a little bit about the platform, but fundamentally, as we think about that circle and how you respond, we're thinking about the people who may be involved, right? Your clinical teams, your staff, your facility teams, whatever it might be in response to the particular event, as well as notifying people, right? Letting, for example, EHRs offline, how do you let the clinical teams who are impacted know that it's offline, keep them up to date? But we're also talking about what's called hyperautomation, which is this idea of how do you also integrate in both your physical and digital systems to help respond to that? So from a security perspective, that might be something like, how do I lock down doors? Or in a infant abduction, how do I lock down the elevators, isolate off that ward, for example? It might be turning on and off servers. So our platform has this capability to bring people and the technologies that you employ, both physical and digital, to respond and mitigate these types of events that happen, both large and small within a health system. Next slide, please. So I'm going to dive into a few detailed examples and give you an idea. And then actually, my colleague, Natalie Senzabal, when we get to clinical, we'll do an even deeper dive. But at this level, you know, I mentioned environment of care, what's called environment of care, really sort of the safety of the health system. Here are some examples when you think about, we talked about things like earthquake, for example, or landslides, floods, you know, and when we talk about locating the resources and locating those impacted, we're talking about, you know, your setting up your emergency operations center, for example, if any of you were involved in those committees, those teams, or your incident team, right? Understanding what facilities might be impacted by those events, which patients, including people who may be in your location, you know, contractors, volunteers who are coming in to support you, support your health system. And you'll see as we go through the examples here, as we look at sort of the natural disaster side of this, right? We can provide this capability around a multi-layered response. And this becomes really critical, not only in responding to a large event like a natural disaster, but Natalie will highlight how that's is particularly critical as we go through clinical events, right? As we respond to a patient's clinical event, and how do we have that multi-layered response and protocol? And then, as I mentioned, in all cases, you know, how do you measure and analyze that response post-event? So we can do this for sort of these large-scale events. And then if you click to the next slide, Elias, we can also address, you know, very specific safety events. And this slide here just gives an example. This is, I will say, based on North American dollars, but you know, one of the, as we move sort of from these large scale events that happen and start to think about the things that impact operations within a health system on a daily basis, we see things like workplace violence. So really workplace violence, and again, for those of you who work in health systems probably understand this, we're talking about violence against staff here in this particular case, right? Which is fairly prevalent throughout the globe, right? As you look across Europe, North America, and the Middle East, somewhere around 20%, and it depends on the country that you're looking at, of all nurses will be physically assaulted during the year. And a much higher number are verbally assaulted. So this is a significant issue for many health systems. In many cases, different programs are put in place to mitigate those events. Here we're highlighting really from, again, using North American dollars, but just as a proxy to show you that the impact of something like that, right, really results in significant operational costs for a health system. And we're just looking here at a mid-sized hospital, 350 beds, both in not only nurses who might leave the field, but sick days, long-term care days, short-term care days, and the responsibility around that. So one of the areas that we do a lot of work around, and if we click to the next slide, Elias, is really being able to mitigate that. And so our platform does a few things here. One is, you know, many organizations around the globe have implemented programs, something like this. Here throughout North America and Europe, it's see something, say something, right? So if you see an event occurring, you report that event up the chain, so to speak, and it can be anonymous or identified, right? So that you can mitigate these events before they scale out, before they grow out of control, right? So if a family member is becoming belligerent with a patient, with a nurse, excuse me, on the floor because of the situation with the patient, right? You want your clinical staff to feel the ease and have that ease of rapidly reporting something like that, so you can get a team down, depending on your response protocol, to mitigate that event before it becomes a violent event that may occur within your health system. So we do a lot of work around that, and Ilias was mentioning our mobile platform plays a big part in that response capability for staff and et cetera. But we also do a lot of work around things like wearable technologies. So we bring a lot of technology to the perspective to really meet the clinical staff where they are and provide them that layer of security and reporting. We have a couple of other things that we do that are also key to many of these programs: the ability to extend your security team to your clinical staff. So if you have clinical staff, nursing staff, for example, who are traveling out and providing home health or visiting nursing type services to patients in the field, many times those are lone workers and don't have an escort of any sort. And so that can be another risk area for many organizations. Or if staff are just going through the parking lot, right, returning after a long night shift, right? Many times clinical staff can be targeted in those types of events, either by belligerent families, as we talked about before, or frankly, even from just a security perspective, again, depending on where you are in the world, right? And so how do you extend your capabilities? We have some capabilities around providing an automated virtual kind of escorting service over the mobile device, where in this case, if the nurse or the clinician does not check back in, a security team can respond immediately, right? So some of the capabilities that we can bring to the table. The last is just giving staff really the ability to ask for help anytime they need it, whether it's a patient who's in trouble, whether it's a patient who's being belligerent, or whether they're just in trouble themselves, and allowing a response protocol, activating the right teams and the right protocols in order to be able to coordinate a response. And in these cases, because these are safety incidents, we actually even extend that where we can provide live audio and video streaming directly to the site where the clinical staff may be having difficulty, so that we can get eyes on the situation. And we can do that in a number of ways. In this case, it can be done over the mobile device. We have wearables, as I mentioned. Ilias mentioned some of our control center or CNL capabilities, which also allow us to control cameras in localized areas or CCTV. So a number of different ways, but again, just extending the capability and safety and security to your staff. Next slide, please. So the last area I'll mention here, and then we'll dive into some clinical examples, when we think about the support services to your staff is, again, a similar kind of capability around keeping your IT systems up and running. Now, these numbers are based, again, sort of some North American reports from the Health and Human Services in the US. But I will point out that, traditionally, these are very common issues that many health systems have, right? Again, there's lots of, for any of you who have worked on an EHR, you probably have experienced unplanned downtime from time to time, as it's a common occurrence, and usually without notification or capability to come back up live. So, and all of those types of things really impact the care that you can deliver. As you go back up and down from your electronic system, going from downtime procedures back into, uptime procedures, reloading data, et cetera, can have a significant impact. And so this is another core area we work with health systems around the globe to help mitigate these events, provide faster response times, get your IT team up and activated around the problem, collaborating in real time. We provide that capability to identify the right folks, get them collaborating to mitigate that, and to keep all the stakeholders, all your clinical teams, basically in the know about where they are in the process in real time. Next slide, please. And so I'm going to talk a little bit about clinical operations. And if we go to the next slide, Ilias, and some of the things we do here. The first is I'll talk about some of the things we do around patient engagement. This is one example of what we do. One of the ways that we help health systems is we bring digital wayfinding capabilities in. We can bring digital wayfinding capabilities into the health system. In this example, this is a patient who's being contacted directly. So the patient is actually on the mobile device. It could be via browser, et cetera. There's multiple ways that we can engage patients. But in this case, we're actually helping guide that patient directly to their appointment. So we have digitized the indoor location capabilities within the health system and then provided that into turn-by-turn navigation to ease the patient's experience and guide them to the correct parking lot, directly to the correct place in the health system. Many health systems are large campus operations. And in those cases, it can be very difficult for patients to find their areas. And so that can impact your operations because the more patients that you have coming late to appointment or missing appointments because they are unable to get to the right place at the right time, so to speak, the slower it impacts your operations and reduces your capability within your health system. So this is one way we reach out. In this case, this is actually tied right into appointment reminders for patients. You can see the Epic MyChart app here. It could be any app, but that's one example here. Next slide, please. Now, the other operational area that we do a lot of work in, and I'll just touch on it here and we'll give an example, and then Natalie will do a deeper dive, giving much more in-depth understanding of that, is really clinical collaboration. So with many of our health systems, we work on starting off really with team response. And so this is really the idea of getting, many of you have response teams within your health systems ranging from a stroke team to a STEMI or trauma team, sepsis. It could be any number of different response teams. And we do a lot of work around getting those teams, enabling those teams to respond faster and more efficiently with better insight. And we'll give you a couple of examples as we go through about how we do that and the impact that can have on the healthcare. In addition to that, you'll see that we, and in natural extensions, we do a lot of day-to-day collaboration capabilities with health systems, providing unified communication across the clinical teams. So not only just understanding your team response, but how do I get a hold of Dr. Smith and maybe ask for some assistance on a patient? And we can even extend that from beyond just sort of, let's say, a chat capability or a phone call into video capabilities where we can actually enable telehealth that would allow us, for example, to have Dr. Smith put eyes on the patient with you and do a video consult directly to provide that kind of capability as well. Next slide, please. And we click, if you could click once, Elias. So let me show you how that kind of paints out in an example. And as I said, Natalie will do a deeper dive here. But in this example, this is a stroke patient being taken to a hospital. So the patient is on an ambulance being driven to the hospital currently. The staff on the ambulance staff actually can reach out and engage the emergency department within the hospital, indicating over the mobile device what's happening with the patient. From there, we can actually, this is an example of how we can activate the right team. So in a stroke scenario, the protocol would be to get a neurology consult. In this case, the neurologist is not actually at the hospital, but the system locates the neurologist, reaches out to the neurologist, gets the neurologist to respond in real time and collaborate in real time on the platform. And we can actually conduct a face-to-face video stroke assessment on the back of the ambulance. From that, the neurologist is able to make a call to say that, yes, this is a stroke, we need to activate that protocol, activates the rest of the teams within the hospital, all of whom receive those communications and respond that they're able to come into that particular event. In this case, we're going to actually fast track the patient down to radiology, conduct a CT scan to determine the type of stroke that's happening so we can provide the right clinical protocol. The neurologist calls for TPA in this case to clear the blockage and stabilize the patient. And as you can see on the last one, if you think one more, Elias. I don't know if it came all the way through. You can see closing the loop and handing off the intensivist, and the stroke code coordinator post-event here. So we can pass that off throughout the hospital. So that's one quick example that just shows you what we mean by this sort of critical event happening and how we get the right teams responding and collaborating. And I think if we go to the next slide, Elias. I don't know if it advanced for you, Elias.
Elias, are you there?
Are you seeing my slides? No, I'm having some technical issues. Can you see my slide? Probably not.
We can see it, but I think it's frozen, Elias.
Yeah.
On the analyze. I don't know if you're.
Let's try that again.
Okay.
Yeah, I'm having some technical issues here.
Can you see my slide now?
We can.
Okay,
yes.
Good. So we move on from this. I'll take it from here. So,
yeah.
Cool.
Great. And I'm going to turn it over to Natalie, who will give you the real expert advice here. So, good morning, Natalie.
Thank you, Eric.
Could we go full screen?
Excuse me?
So could we go full screen on the slide deck?
Oh,
perfect.
Perfect. And just yeah.
Over to you, Natalie.
Thank you so much. Hello, everyone. My name is Natalie Senzabal. I am a nurse by background. I spent most of my career in critical care, and I have been the last 10 years working in healthcare IT. I've worked across many large health systems as a nurse and now as a clinical consultant. And that's a large part of what I do for Everbridge is I work with new and existing customers on improving workflow, improving process improvement, and quality of care. Next slide, please. And so Eric had touched on our clinical codes, some of our clinical codes at a very high level, and I wanted to take a deeper dive. This is an example of a project that I completed within the last year, which you can imagine was very challenging. This was a start-stop situation because of COVID, but this is a code stroke workflow that I worked with a hospital in North Carolina. And I don't expect you to read through this video. It's kind of blurry and there's just a lot of words here, but basically the thought is it shows you how complex this workflow is, that it takes an immense amount of communication, collaboration. There are a lot of points of breakdown. And just to back up a little bit, I did want to mention the fact that, again, I work with a lot of health systems across the United States. I would say a large majority of this workflow is manual. And what I mean by that is prior to using Everbridge, what I typically will see is an operator or someone in telecom will send out a code notification. They usually can't find the on-call team in one place. So often maybe the physicians will be in a scheduling tool, the nurses and techs may be on a piece of paper, could be a link on the intranet. So it takes that person time to figure out who is the on-call team and how do I notify them. So we take that information and put it all into Everbridge and automate that workflow. So in this situation, a stroke patient may have different entry points into the workflow, meaning the patient may arrive in the ED with a family member. They may arrive via an ambulance, or they may be already in the hospital. None of that matters. After the first couple of steps, they are in the code stroke workflow and we automate it from there. So an example is, we'll say that the patient arrived via an ambulance. They are in the ED, they notify a neurologist to do a quick consult. they determine, yes, this is a stroke, and they call the operator. The operator then launches a code stroke. And when I say launch, it's literally about 2 buttons that they have to push, and the entire team is notified. The entire on-call team is notified. How we do that is I work with the teams very closely to determine the workflow, who needs to be notified. And also we create templates within Everbridge. And a template is very customizable. So I work with these teams again to say, what is important to you? What do you need to know to treat this patient? And every team can have their own type of template. And we go out, we look at the on-call schedule that is housed in Everbridge and automatically send a notification to those teams on call. Best practice is that they receive that notification via our Everbridge mobile app. It is the most reliable and the quickest way to receive the notification because it uses either Wi-Fi or cellular. And once they receive that notification, they click confirm, and then they have the ability to chat amongst each other. If they do, in this situation, if they do not confirm within their application, within 1 minute, we call their phone. We give them another minute and we text their phone. And again, this is all customizable, and each team decides how they want to be notified. So we'll say that the team is on the way. It is now determined, patients had the CT, it's now determined that they do need to go and have a procedure done and have a thrombectomy. In this situation, at this hospital, they have chosen to do an update. And by that, I mean, they will call the operator back and say, we need to update. Patient needs to have a thrombectomy. The operator can simply go into that old notification, click update. All that information that was previously entered will flow over into the notification. Everbridge now knows that they need to go out and look at the on-call IR team. So again, we start that whole process over with a new team. And this hospital in particular said that they really struggle with that last piece, meaning we know it's a stroke patient. Now we know they need to have a procedure. And to get that IR team notified took a lot of phone calls, looking up new team notifications. How are we going to notify them? And that was taking them time. So to automate that last piece has been very, very helpful to them. They do plan to take this a step further. They have not implemented this yet, but they would like to put an iPad in the back of all the ambulances and actually start that neuro assessment before the patient even gets there. Again, shaving off more time. So their end goal will be to reduce the needle to door to needle time, improve communication, and reduce the number of phone calls. Next slide, please. Eric had mentioned Mayo Clinic as a hospital that we have worked with in the past, or a system, I should say. And we did a research study with them in which they did do the neuro assessment from the back of the ambulance. And by doing so, they found that they were able to decrease the door to needle time by 8 minutes. They were able to save on average $4,500 per patient stay. And obviously the patient, if they're treated sooner, they're going to have better outcomes. And it may make the difference of whether a patient walks out the door or is wheeled out the door. So every single minute with these teams and with these clinical codes is very vital. Next slide, please. And so we've talked about stroke. You can imagine that every clinical code we can automate. And what I have found when I start working with the hospital is often we'll start in one area. We'll start with stroke, we'll start with STEMI, and then other teams will come forward and say, hey, I want to do the same thing. And it just grows internally. And for some of you may not be familiar with the term or the acronym STEMI. What that stands for is ST, escalation, myocardial infarction. So someone is having a very bad heart attack. These are the people that they thought they were healthy, and all of a sudden they're very sick. And they have 90 minutes from the start of symptoms to getting that blockage released. So again, in a STEMI, it's the largest vessel in your heart that supplies the blood is either blocked or partially blocked. So it's very fast moving. So this is a project that I finished within the last 6 months in New York City. And this looks complex, but honestly, it was even more complex than this. And they were an amazing team, and I'm very excited with their end result. And today they have the New York Fire Department actually is sending the EKG from the back of the ambulance. That goes to, well, let me back up again. They're sending it from the back of the ambulance, and they're sending it via an email. Everbridge ingests that email. We know by looking at the schedule that's in Everbridge that which cardiologist it needs to go to, as well as the ED attending, so that the ED attending knows they're going to be wheeling in pretty quickly. They are able to see this EKG within the Everbridge mobile app, confirm, yes, it is a STEMI. The ED then calls the operator to launch a STEMI. The end goal is that the STEMI team actually beats the patient there. Now, of course, it depends how far the patient is out. Then excuse me, I think we want to go back. There we go, thank you. So then you can imagine sometimes the patient walks into the ED or is dropped off by a family member, or the patient is already in the hospital. And yet another scenario is that the patient was being transferred. And again, none of that really matters how they get to the hospital. The fact is that they're having a STEMI, and we have less than 90 minutes now to get this taken care of. So the operator has to determine which template to send. And why that makes a difference is during the day, people are at work. They're there, they're at the hospital, they're already in the cath lab. But at night, after hours, holidays, weekends, they're not. They're at home, they're in bed, it's 2 o'clock in the morning. So the operator will launch that template. With that template, we know we basically are going to blow their phone up. We are sending it to the application, or the Everbridge application. We are sending it via a text. We are calling them. They have 5 minutes to confirm. If Everbridge knows we're looking for 5 people, if only 4 people confirm, we are auto escalating to the cath lab director or to the cath lab manager. They then know, okay, somebody on that team has not responded. I need to go in and see who has not responded. So we'll say in this situation, it's Eric. So I can see everyone else has responded except for Eric. I need to get a hold of Eric. And then that cath lab director goes in and starts calling Eric and let him know that he needs to get to the hospital. Now, that doesn't happen very often. They said maybe once or twice a year, but it takes the manual process out of somebody waiting for a phone call back or looking to see that everyone has confirmed that Everbridge does that for them. And again, we can send to, I talked about nurses and techs, but we also can send this notification to departments. So to the lab, to pharmacy, to x-ray, to whomever you want this notification to go to, we can send that. Again, it could go to a desk phone. So we can still send to pagers. Most hospitals are moving away from pagers, but we can send to pagers as well. And so of course, the end result and the goal is to improve these times. And New York would like to eventually have this patient bypass the ED completely and go straight from the ambulance, straight to the cath lab, again, saving more time. And all of this is a perfect way to gather your information for reporting. All of these hospitals have to prove that they were able to treat this patient in 90 minutes or less with a stroke, a different time. Each code has a different time in which they have to have their patient treated. And so we do have quality reporting for that as well. And so with that, I think we are ready for our next polling question.
Thank you very much, Natalie. Thank you for that. So our next poll is, how are you currently integrating physical security systems? So that comprises everything which goes from CCTV, IoT devices, any sorts of components or devices that can bubble up information from your organization, which allow you and support you in taking better decisions. We'll give that another 30 seconds. Yeah, so we have some results stabilizing there. So we have roughly 10% saying we are not, 27% through a video system, 45% through an access control system, and through an integration platform, 18%. That's quite high on the 18%. I was expecting a little bit less, as you know, leveraging integration platforms is something which is also quite complex. And in general, that's not the core business, of course, of healthcare organizations. So they tend to probably spend a little bit less on that. But interesting results. Thank you very much for the poll. And I believe the next part is to get along our panel discussion. And obviously today I'll be your host on the panel. And thank you for our guests in joining us. And let me please have the honor of starting by introducing Dr. Sumida Sani, who is one of the Everbridge partners. She is the managing partner of Sumida Sani LLC, along with her colleague, Dr. Sunil Tatpali as well, senior partner. Again, I will not go through the long curriculum that both doctors have, but I would limit my statement in saying that they're both very passionate about the correct use of technology and how to use that technology to support medical best practices. And I believe their mission statement is fundamentally that. It's how to encourage the use of technology within the healthcare domain and system, and that's the services they perform. Dr. Sumida, Dr. Sunil, thank you again for joining us. It's an honor having you with us today. Along with that, we also have Mr. Sravan Kumar, the Deputy Director, Quality and Risk Management from Tuleka Hospitals. And of course, last but not least, my two colleagues, Mr. Eric Chatwins and Natalie Senzabal, which you've already seen. Thank you all for joining. So I don't know if we have any questions that came in from our audience. Please, I encourage you, if you're shy in asking the questions directly, perhaps to use the chat box as well. And just to get things a little bit warmed up, perhaps I can address the first question to the panel. Yes, please, we have Mr. Bandar Al-Jasser who raised a hand. Can we please unmute Mr. Bandar? Hello.
Yes, hello everyone, and thanks for these interesting presentations we had today from the speakers. It was really nice to share with us. My name is Bandar Al-Jasser. I'm the Director of Quality Improvement to Patient Safety Department in King Abdullah University Hospital, one of the academic hospitals in Saudi Arabia in Riyadh. So my questions here, I saw lovely examples about the automation and building, let's say, a reliable system for crisis management. My question is, how does it take from you as building an infrastructure which is ready to adopt these smart systems in place and building these reliable systems? Does it require a particular infrastructure from IT systems, from security systems? And speaking about the human resources as well, in matter of training and have them involved in these activities, does it require, let's say, a readiness level from infrastructures and human resources to be ready for this transformation? I would like the experts' opinion regarding this. Thank you.
Thank you very much for your question, sir. So perhaps, Eric, you'd like to start on taking on that as, being an industry solution expert around this domain, and then we can also have an angle from Dr. Sumida, Dr. Sunil, and Mr. Sravan as well, what he thinks from this from his own perspective. Thank you, Eric.
Yep, happy to do so, Elias, and thank you for the question. So first off, I think from a technology perspective, both Natalie and I, and just maybe taking some of the clinical examples, but it applies to other areas as well. The Everbridge platform, the technology we're sharing, really is designed to work alongside many of your systems, right? So much of what we just shared is provided through a SaaS platform. So, many of the capabilities do not require on-premises technology solutions. Now, I think from a technology perspective, certainly you do need electronic means of communication, right? So that could be Wi-Fi, it can be cellular, again, depending on the scenario. In many hospitals, obviously that's Wi-Fi within the hospital, cellular outside the hospital. Our platforms work across both. It could be a paging infrastructure, as Natalie highlighted. There are still organizations doing that in many locations as well. It could be, but whatever, it could be voice phone lines, right? So depending on what you have for technology in place, the platform is designed really to be able to support those types of technologies. So I would say from that perspective, on the communication side, it's fairly limited. I think as we talk about integrating into other platforms, like Ilias highlighted earlier, depending on how you want your response to be, if you want to activate systems or physical or digital, then obviously there's some integration capabilities that have to happen there as well. I do think I want to point out, and Natalie made it look a little easy, to be honest with you, but I think as we think about those workflows, and particularly clinical teams, right, there is a lot of change process management that has to happen with almost any of these. And that's really, and I'm sure my other panelists here will speak to some of the same things. I know that's, really Natalie's expertise from an Everbridge perspective is working with those teams, not only just to lay out a workflow, but really understanding the change management. What are the policies you might have to put in place, for example, with your various teams? And then how does that workflow work? How do you get everybody on the same page? So I think there's a bit of both that has to happen. We work from both perspectives on Everbridge with health systems to try and make sure that they're as successful as possible. And with that, I'll open it up to others on the panel who might want to offer some other perspectives as well.
Definitely, I think our partners will have a certain opinion as well on that. And that's, again, we rely heavily on our partners to understand the markets, understand the needs, the challenges, and also deliver those challenges as they are declined towards the different, accents that we have within the region. Dr. Sumida, maybe you can share with us some insight a little bit on the challenges that you have seen and you have faced, and what are you building around on top? Of course, you decided to partner with Everbridge in this journey, and definitely you have some plans, and perhaps you can share a little bit around that.
Sure. Thank you so much for allowing us to participate in this discussion. And as Eric pointed out, it is about the use of the platform, but it's also about the use of what Natalie very correctly highlighted, and that is, the processes, the workflows, etc., that are developed. So one thing to make very, very clear, and Elias, you introduced us from the point of view of enabling technology to really become a great support to healthcare. So to enable the technology to really do what it is capable of doing, there's a lot of work to be done outside that. When I say a lot of work, it's not that it's insurmountable, but there are elements that have to be very clearly defined. How does that technology become the enabler to deliver the outcome that it is expected to be delivered? So one of the things that we look at, and this is in fact the gap or the shortcoming, most people who are looking at adopting a technology think that it's, you bring it and you plug it and you play it. Yes, it's beautiful, it's beautifully structured where it can function like that, but it's not that you turn on a switch and it's going to start doing its things. So what we are seeing in this region is the need for making it very clear in terms of, being able to do pre-adoption audits or scrutiny, working with the partners to understand where their needs are, what are the areas which need to be tided over, bolster them with the SOPs that may be required, bring in the training that is required so that, yes, everybody can start using the technology in the best way that it's possible and to get the outcomes that are expected to be obtained from the use of the technology. So I don't know how much time we have. One can go on. Maybe Sunil wants to add something here.
Yeah, maybe.
I think one of the points that Natalie made was that when you go to a hospital, you may like to start with a single project, a small kind of pilot project, and make sure it runs well. So get the low-hanging fruit. Once you're succeeding in one project, then I'm sure the rest of the colleagues in the hospital would like to adopt something similar. I think I see that happening all the time.
Very good, very good. Thank you for that. I have another question coming up. I think it's on the chat from Amina. I'll read out the question and then probably we can start again with a round table with Eric. So, as a big risk that I face within my organization is lack of integration between different systems. Even with high tech, those different systems are not integrated, what Everbridge can offer in this regards. And just a brief comment on my side here. If you recall in part of my opening statement, there was a slide where I depicted the assess, locate, act, and analyze, right? And then below that, there is all of that integration layer I was talking about of the different technology that you might have. So that's where we come in as the glue in tying in those different processes. And as Eric stated as well previously, some might be digitized, some might not. And we can assist you in digitizing those that are not. Perhaps, Eric, you can integrate and complete my answer with that with some additional information.
No, I think that was a great description, Elias. So yeah, I think integration is a challenge for everybody, right? So just to be clear, if you have technology systems, everybody faces integration challenges. So I think we've done a number of things at Everbridge to try and make that easier for customers. Elias highlighted earlier over 350 integrations currently within the platform, and what that really means is the idea of pre-built connectors. Right? Something where we've reached out, whether it's a security system, a clinical system, an IT system, a physical system, and pre-built and partnered up with those organizations. And that can range from things where there's, we often talk about standard protocols I'll put that in quotes for a second, right? So it could be the standard protocols, or it could be, proprietary protocols, right? So that's one way that we work with customers. Certainly, if there's a system out there, and we run into them all the time, that's not on the 350 list, right? Although we've tried to target the most popular, we could certainly work with you. We have a professional services organization that can work to do integration capabilities depending on your technology. And we really see that as kind of the mix of services that allows us to work with customers and then prioritize. I think the other element Elias mentioned, right? You mentioned the assess, locate, analyze. Prioritizing which integrations are really the most critical for you, right? As we talked about process, Dr. Smita, both talked about, the process. And so prioritizing which ones are most critical and focusing on those first. So I know from an Everbridge perspective, we see that. I would turn it over to our partners, Dr. Smita, Sunil. I don't know if you see that as a common set of challenges as well.
That certainly is a common challenge. And you correctly highlighted that there are standard protocols that can be incepted and brought in very rapidly. And as I said, it is actually dependent on the unique features of a particular health facility that is seeking to bring in these kind of support systems and the use of the platform. So that is where you're right. I mean, there's a kind of a checklist which takes probably cognizance of all the major areas that do need to be covered. And depending on what is already existing, one would then focus upon what needs to be met. And interoperability, I think Sunil speaks a lot about it. He's able to, and you're quite right. What are the most important flow throughs that we do require? That's one of the things that is not just a problem in emergency response systems, it's a problem in regular healthcare. So you can imagine that if we have to tide over that or bridge those gaps in the general healthcare delivery systems, then we certainly need to do it very, very well in the emergency healthcare scenario. Sunil, would you like to add something?
Yeah, I think there are just a couple of things that I would say technologies which are working very nicely towards this area of integrating, because we all know that many systems are existing in their silos. I think one of them is so-called FHIR, Fast Healthcare Interoperability Resources. This is a standard now already in the release 4 version created by HL7, International Standards Organization. And what they're doing is they have interoperability as a goal almost. And I think almost all the major systems in the US, in Western Europe, in Australia, Canada, India, everyone is adopting FHIR now. I think that will make systems more interoperable and talk to each other because it uses a lot of web standards. The other thing is heavy use of, I would say, application programming interfaces, or so-called APIs, again, which are being used. And Everbridge, I know, has a lot of APIs. So you can use these APIs to create that kind of integrations that we want to do. Because this whole thing is quite a long topic, but I think these are 2 things that we can concentrate on to get them going.
Definitely. And Natalie, perhaps you would like to share with us some of your own insight around the challenges on technology. And again, we can integrate in different ways, right? So we can do it in a loosely coupled way by using email ingestion, for example, or we can go all the way to something on a fully fledged connector, which incorporates some logic in it, etc. How was that from your own experience, Natalie? Can you share with us some insight on that? That would be great.
Sure. The biggest piece that I see in working with these clinical teams, again, I had already mentioned that there isn't one source of truth where these on-call schedules are kept. And so many times they don't want to have to enter these schedules or the on-call schedules twice. And so they would like to do some sort of integration. So let's say the physicians all have their on-call schedules in a certain solution that we can integrate with them, pull those schedules over into Everbridge. That way they're in Everbridge and our workflow, the workflow that I had mentioned works, but yet they're not doing duplicate work. A lot of our hospital systems are interested in integrating with the EHR, and all of them have a different way in which they want to integrate, but we're able to do that as well. So a lot of our conversations go beyond the workflow that I described, and they are around integration, but they all have a different way in which they want to integrate. We also have to have all of our contacts within Everbridge, or none of this will work, right? So we do integrate with HR, and we'll pull that contact information from their HR system, again, decreasing the amount of work to make sure that all the contacts are within Everbridge.
Which kind of gives me the opportunity to hitch on the next point, which is also a question that came up. What's the process of data migration? Again, this is broadly speaking the question. And second, how is the confidentiality of data being maintained? So maybe we can articulate a little bit around that. What are the certifications that we adhere to? What are the guarantees we provide to our customers around their data? And of course, the fact that we provide our services through a SaaS platform that comes with advantages and disadvantages, which kind of tie into the next question coming from Faisal as well. How do we know that technology is ever changing? How can we keep up with the pace, with the cost? That's one of the benefits of a SaaS approach, right? Because you transfer most of that cost to the service provider. But of course, you will also need some guarantees around data privacy, how the data is being managed, etc. So maybe again, Eric, I always pick on you. We start with you. How do we see that? Because again, sure. Data privacy is a hot topic in the region. there is a tendency to prefer, let's say, on-prem type of solutions, right? Which is, again, something which we do not typically recommend for different reasons. Some of them, which I can highlight, is cost, complexity, maintainability, extensibility, right? Of course, the downside is people might have a feeling that it's less secure, right? And then we will need to open up that Pandora box of what security actually means and what guarantees do we provide around that. Eric.
Yeah, no, great question, both of them. Maybe just starting off with the data migration question, and then we'll touch a little bit on security privacy. You know, I think Natalie just highlighted some of the, you know, from a clinical perspective, some of the systems, some of the places you'll find data, right, within a health system that needs to come into the system. You know, maybe to add to that, I want to add that there is a lot of complexity, right? Because when we're talking about the data, it's not always one source, right? There may be multiple HR systems. Natalie was kind of talking a little bit about the on-call schedules. It may be in a technology, it may be on a piece of paper, and it may be all of those, right? Maybe in a spreadsheet, all that kind of capability. So, you know, we spend a lot of time thinking and helping our customers through migration, and the migration of data is quite often, obviously the ultimate goal is to automate as much as you possibly can, right? So that, you know, you're keeping consistent data. A good example, Natalie mentioned the contacts or your staff, right? You're staffing your system that you have to reach out to and communicate with. You know, as your HR system changes, as your people are providing their updates, as your staff are providing updates, you want those in real time to happen within your system, right? So that when you reach out to communicate and collaborate with them, you have the most accurate information to be able to get a hold of them. So now, having said that, we work quite often in a sort of staged fashion to bring that data into the system so that we can work with teams to kind of phase that capability in, right? It could be an upload process as a starting point. Elias, you were mentioning kind of the different ways the scale of integration capabilities, right? Can be quote unquote simpler, lower IT investment, working up to that more automated over time kind of approach. And that can happen in any of the sort of the data migration pieces that we talked about. Just touching on the security side here for a second, you know, as we mentioned, the platform itself is SaaS, and the benefit that Ilias has highlighted is exactly right. You know, by being a SaaS platform, we're taking Everbridge in this case is taking on the responsibility of keeping everything up to date, meeting the latest standards. You're not waiting for someone to come to your site, whether remotely or not, and apply the latest patches and downloads to keep your on-prem solution up to date with security standards. Now, the other side of that is it does raise concerns for many organizations about security. And so Everbridge has invested very heavily in security of the IT platform. You saw some of the certificates that Ilias mentioned earlier. Just at a high level, we do a lot of government work. So, you know, our platform is certified for organizations ranging from the US Army to national countries that I think Ilias talked about. And so they all demand, as you can imagine, very high levels of security from a PII perspective, right? Protecting confidential information and personal information about people. For our healthcare clients, we extend that a step further. And so all the communications that Natalie highlighted are what we would think of in the US as HIPAA compliant. There are standards around the globe that are similar, which is the idea of, you know, protecting patient information, right? Patient health information is protected at a higher level of standard. And we build all those security controls into the system, everything including access and encryption and et cetera, built directly into the platform to secure those. So it's sort of sorry, I know that's sort of a long-winded answer, but there's multiple facets that we really need to bring to the table in order to solve some of these challenges. And with that, I'd ask any of my colleagues if they have other points that they would like to add to that from that perspective.
So if I may contribute here, because I've been in the region for the last 16 years, and I've worked in the public healthcare system in Abu Dhabi under Saha, as well as watched very, very carefully as to the evolution of data regulation and privacy security standards coming out of both what is now Department of Health, looking at DHA, and also what is happening in Saudi. So I can at least speak about these with the relevance to the question that was raised. Now, there has been an evolution of policies and regulation related to how data is to be treated, especially healthcare data. And this region, historically, by legacy, has had an inclination towards adopting standards from the United States and also maybe from the UK and from Europe. Now, earlier there used to be a very clear segregation that, you know, they adopt HIPAA guidelines and they look at completely adopting the US methodologies, but also because of the proximity, it was Europe, and also definitely there have been evolutions on both sides. So let us just say that in this region, people or healthcare systems do not just meet one set of standards. They have to meet everything. So whatever is most challenging from the US, whatever is most challenging. In my role previous to being an independent consultant, I was head of medical affairs at Becton Dickinson. And although it is headquartered in the US, BD is very large in Europe. And that is where, especially when the pandemic broke out, we were looking at trying to comply with the GDPR requirements in terms of security and safety, privacy, and also meet with the HIPAA. So this is typically what we do see in this part, in this region. And the other aspect is that the policies and regulation relating to how healthcare data is to be treated, in my opinion, is still undergoing a little bit of a transformation. Because of the way that the systems are developed, it becomes almost, a common thing to be utilizing cloud-based services, etc. So therefore, we need to look at what is the national regulatory framework and comply accordingly. And that is possible, I think, with Everbridge Platform. And that is what is so exciting. You can adapt it to whatever is the national requirement in terms of regulation and compliance. So this is what I can contribute in terms of my understanding of how it would work in this region.
Thank you very much, Dr. Sumida. For the sake of time, I'm not sure, Badebo, do we have one more question? Can we take very rapidly the last one from Afifa, and then we can wrap it up? Thank you, thank you. So the last question, which I see on the chat board, I believe everybody sees it, how to change the mindset of workers, especially public sector organization, towards digital transformation, as it is big challenges for them to shift from manual to soft. Now, this is, I think, more a policy type of question rather than a technology one, right? So perhaps Eric and Natalie, you can share the experiences on how that was lived through in a market like that of North America, and happily to have the feedback from Dr. Sumida and Dr. Sunil on how they see that as well evolving in the region, which they know better. Of course, I have my own view, but I leave it that to the experts to kind of comment on. Eric, please, Eric and Natalie.
Yeah, maybe I'll just comment briefly and then ask Natalie, because she's really lived this on the ground. I think, you know, so we talked about North America. You know, many of the hospitals that we highlighted are public sector hospitals, just to be clear, and our public health organizations. And as we think about this digital transformation challenge, I think, you know, there's certainly the technology side, but probably the people and the change management side is really the larger factor in any of these types of changes. And Natalie, I know you shared a couple of examples, but you've worked with a bunch of our healthcare clients around this. I don't know if you want to comment with some of those change management challenges.
Right. So the most successful projects that I've had typically has a group of leaders that meet, you know, maybe once a month, and they make the rules. They determine how a project is going to be run. They determine, just for an example, will we let physicians make their own schedule changes or not, so that it's uniform across the board, that every team and everyone is doing their project the same way. So I really felt like it is helpful to start with a group of leaders. If there's any sort of conflict, we go back to that group and have them make a decision and then let the others know that that is their decision and that's how we'll move forward. I think for everyone to have be on the same page, for it to all work the same way, that's important to start the group of leaders.
If I can just chip in over here, I think it's very, very important, and I have set up and transformed setups over here, working with very, very senior staff. Now my domain is lab medicine and integrated healthcare delivery. So I've seen how transformations need to be handheld, and this very, very important aspect of change management dealt with. I believe, and in response to specifically to the question that was raised, the best way to convince the leaders in an organization is to be able to present the facts very, very objectively. So this is about understanding how to really lay it out there, because numbers speak. So it has to be a good scrutiny of, an area of focus that is brought up, or many areas of focus, and draw out the salient outcomes that one is seeking to change. Create a roadmap towards how that change would be brought about. Get the buy-in from the leaders. Actually, when they see the objective information presented to them and also the possible impact, the risk, then you already have their buy-in and the change management becomes better. When it comes from the top, then everyone else will fall in line. It has to come from the top. It has to be them speaking out, and to convince them, we have to use these methodologies of complete objectivity and presentation of the facts.
I think, just one last point. I think we need to adopt a kind of mobile first strategy, because while all of the employees may not be comfortable with using computers, or everyone uses a mobile phone. Okay, let's face it. So now we have the technology available to have a kind of mobile first strategy in terms of responding to these. That's all I have to say.
Absolutely. And the good news is, from a technology standpoint, we have everything you need for that at Everbridge. So
absolutely.
from a technology.
Yes.
Okay. For the sake of time, I believe we should wrap it up here. Again, I want to thank very much and very warmly and Dr. Sunil, Dr. Sumida, for joining us. I was informed just only now that Mr. Senzabal was not able to join us. He had some other impediment. Natalie, Eric, thank you again as well for your presence. I know it was extremely difficult for you. It's given the time zone, it's like 3 a.m. in the morning, but we highly appreciate your effort and sharing with us your experience in North America for the benefit of our audience here in the Middle East. And with that, Debo, I believe I can kind of hand it over to you for the concluding statements.
Okay, thank you so much for that. I think we've gonna be rounding up for today's event. Thank you everyone for joining us, and we really appreciate your time, and we look forward to hosting you in our subsequent event. Thank you everyone. I'm gonna be closing the Zoom link in another 2 minutes. Have a great day. Bye.
Very good. Thank you everybody. Bye-bye.
Thank you.
Thank you all.